Oh, listen to that heart. It's beating so hard. Yes, it is.
At the Bondi Referral Hospital SASH, Denise from the rescue group Pause has brought in a 1-year-old orphan called Olivia.
Her heart, it's just pounding. It's pounding. If the room was silent, I believe you'd probably hear it. That's how loud it is. I think this little girl's in serious trouble. She could not be rehomed because, you know, she's got this problem. The pound cannot sell her. So death for her, that's it.
Hey, beautiful girl, shall we have a listen to your heart? She's got a really loud murmur. It's okay, Bubby.
Emergency vet Lisa Chimes immediately takes Olivia for an ultrasound to confirm her diagnosis.
We grade these murmurs out of 6, and she's got a murmur that's a grade 6 out of 6, so that's the highest. It's just tragic. A heart murmur means that there's an abnormal blood flow in the heart, and if we don't treat it, that blood volume going in that abnormal direction is going to put an extra strain on her heart muscle, and she will go into heart failure, and she will not survive more than a few months, a year, probably max.
I don't want to imagine anything is going to happen to her, and I'll probably start crying about that, but she's alive and she's going to stay that way. Aren't you? Yes, you are.
The operation to fix this heart murmur will cost at least $3,000.
We ask for donations, and whatever isn't covered, I will cover myself.
Wow.
You deserve to have some more time to live a normal life, don't you? Yes.
Hello.
Hi, Lisa, how are you?
I'm good.
This is the
How
big day.
How
Next
you
day
feeling?
at SASH,
very
Denise
nervous.
brings in Olivia for the procedure which will hopefully repair her heart.
Good. Everything will be all right. You know, this poor dog has had no luck. It's time that her luck changed. And hopefully it will change now.
Okay.
Cardiologist Dr. Rita Singh will be performing the delicate procedure on Olivia's critical heart murmur. The condition is also known as a PDA, a patent ductus arteriosus.
There's a little bit of tension, nervous energy here today because this is a fairly new procedure at SASH. Traditionally, we've always fixed a PDA by cracking open their chest and tying off that blood vessel. But now we're going to try a newer technique where we don't even do surgery. We just feed like a plug up one of her vessels and plug it off from the inside. Fingers crossed it works.
I've got to do very carefully, so it's taking me a little bit of time.
If this new technique fails, surgeon Andrew Marchevsky is on standby to perform traditional open heart surgery.
The problem with her is she's a really little dog with a really big abnormal vessel. And because of that, we can only get quite a small plug up her artery into her heart. And the plug size that we can get up there may not be big enough to actually plug the hole. And if that's the case, then it's back to me.
Here we come. So it's coming now. See, it pulled through. Yeah, it's too small for it. I'm just going to try once more, but I think this is going to be just too small.
Rita has to be really careful here because if there's one wrong move, it could tear through her vessel and she could bleed out. So it's pretty risky, pretty fiddly, and there's a lot of pressure on here.
It takes way longer than I expect it's going to.
Cardiologist Dr. Rita Singh is struggling to block the faulty vessel in Olivia's heart.
Well, I'm going to try to push the plug in now, but as I said, I think it's not going to work.
Despite Rita's doubts, the plug is finally in place.
Yes. I'm going to keep my fingers crossed the next 24 hours now and we'll see.
I'm getting a little bit excited now.
Finally, I'm going to let you get excited.
Yay, Rita!
Just when the team is starting to celebrate,
Let's put you to bed.
suddenly Rita notices a change in Olivia.
I think it's moved.
Really?
I can hear a continuous murmur now.
Their joy has turned to devastation.
Poor dog. Oh.
We're just in complete shock here. I mean, everything was looking so good and Olivia was recovering, and then in a second she moved too much and the murmur's back. The device didn't work. It's really disappointing.
That's it. This has to be surgery now. I thought we were done and she was going to be fine.
So she's just over here, having a little rest
Hello.
after the anaesthetic.
Later that afternoon, a shattered Denise is allowed in for a quick visit.
Can I pick her up?
Yeah, you can pick her up.
Very, very distressed. Really distressed. Yeah. Didn't want to open her chest if we didn't have to. We took the easy option, but it didn't work. So now we go for the hard option. So you've got one more chance. One more chance, hey?
Hello, puppy.
No pressure today.
No.
None.
Last chance in, huh?
2 days later, Olivia is back at Sash for her second heart operation.
The buck stops with you.
Yep. This is the last chance for her. It's either going to work or she'll die, you know. This is a really big heart, and this is this abnormal vessel. So we're just going to dissect around this and tie it off, and then immediately everything will start going in the right direction. It doesn't take much dissection in slightly the wrong plane to dissect through the heart. If that happens, it's all over. It's delicate. The vessel that we're dissecting around is so thin-walled, and if I push it at all, I'll just push straight through the vessel, and then it's all over.
At Sash, the open heart surgery on rescue dog Olivia has reached the critical stage. The pressure on surgeon Andrew Marchevsky is palpable.
All right, I'm just tying it off now. All right. Goosebump moment. Yeah. She's fixed. That's pretty exciting, huh?
I knew you could do it, hero Andrew.
Thanks, Lee.
You're amazing. You're my hero. As composed as Andrew was, you can even see it in his face. He has really breathed a sigh of relief that this is over.
She's going to take a few days to become good, but I think Olivia will find a home now because she should be just a normal, trouble-free dog.
Who's this? Oh, look, here's your new mum and dad. There you go.
As for Olivia, she's made a full recovery. Her foster mum Denise has found the orphan a permanent home with Terry and Spen.
Oh, I miss her heaps. I will. She's such a lovely little dog, but she's ready to go.
We couldn't have wished for anything better.
Isn't that lovely? She's
is
perfect,
just-
isn't she?
She's gorgeous.
And she loves you.
It is emotional. She's going to be the sunshine in our life.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.